It was during colonial times, 12 years before Australia existed as a nation. The streets of the quiet, peaceful town of Bowral in the New South Wales Southern Highlands were lit by kerosene lamps, and it was to be another 20 years before a telephone exchange was built. But for the 1,200 or so settlers in the growing town, one thing was clear. It was time to build a district hospital. On the 4th of September 1889, the 6-patient hospital opened. As the district grew, so too did the hospital. Staff numbers expanded, and with them, the buildings. The Tyler House Nurses' Home was opened in 1954, and the 1960s welcomed maternity and casualty wards. For many years, the hospital was largely staffed by country general practitioners like Dr. Terry Flynn.
Well, you had to be very much an all-rounder, right? You couldn't be a general practitioner like a city practitioner because you did need to know how to deliver babies and how to do regular surgery and how to give an anaesthetic and how to treat an emergency. And you had to be able to do all of that. And basically you were the staff of the hospital.
The 1950s post-war baby boom meant the hospital needed to significantly increase birthing facilities, and so the Milton Park wing was opened in 1961.
On the top floor, as you know, there's the operating theatre, which is still there, but at the other end of that corridor there was the labour ward. That was created to give you a high level of sterility, as it appeared, with the white tiles on the walls and so on, and the exclusion of anybody who might be slightly a bit dirty, like husbands.
Nursing roles were also vastly different to today.
There were no resident medical officers at all. All there was really for the provision of health in the district was the nursing staff and the local doctors. There was no accident and emergency section. And so, if there was an accident and the patients were brought into the hospital, well, the nursing staff would have to assess the situation.
It was a real country hospital, and even ward staff did operating theatre call, and the surgeons didn't expect that they would have someone who really knew what they were doing. They expected they would have a registered nurse, but they might not know what they were doing. And also we had to deal with whatever happened because there was no helicopter. So whatever happened around the area, they came to us, and so we found ourselves doing neurosurgery occasionally, not very often, but chest surgery, because if the patient was not going to survive to get to Sydney, then we had to do something.
For the doctors, this meant a transition from general practitioner to general surgeon.
In head injuries, you would have to open a skull and see what you could find, and if you didn't find what you expected, then you were in big trouble. But that was way back in the beginning, yeah. And then from there on, we other specialists arrived in dribs and drabs, and we had orthopaedic surgeons come in, and it was much easier then.
With the 1970s came great change for the district and the healthcare provided by the hospital.
I came here in 1979. I came as an orthopaedic surgeon. There hadn't been any orthopaedic surgeons full-time here before. There'd been a visiting fellow. And I also took on the job as the director of the Watson Rehabilitation Unit.
It wasn't all hard slog for the staff of the hospital. Over the years, their social activities have helped enhance great camaraderie among the dedicated workers.
We had fetes and we had concerts and we had reviews and we had nurses versus doctors hockey matches, and so it made for a very cohesive staff, and you didn't have very many people, so people were very much multi-skilled.
When I arrived, it appeared to me that while there were functions for the doctors and functions for the nursing staff, there was no function which actually incorporated everyone. And so with a name like Flynn, I thought, we'll hold a St Patrick's Day party. So on St Patrick's Day, we held a party and everyone was invited, you know, so it didn't matter if you were a cleaner or the general manager or a doctor or a nurse. And we used to hold them in what was the Watson Rehabilitation Ward, and we'd have a spread. The kitchen would provide sandwiches and we'd have cake and green jelly. And on one occasion the kitchen made me a beautifully green iced cake, and inside was orange, which is the other side of Ireland, and I think they put a stick of dynamite in the middle just to make sure that we realised that things were a little turbulent in Ireland at the time.
Without hospital auxiliaries, fundraising activities for the purchase of hospital equipment and upgrades wouldn't be so easy. The work of helping hands like Joan Liebmann's can be seen everywhere.
I get a lot of pleasure out of helping people and seeing the smile on their face when they're happy. And very often in the street, you meet people that have been in and they've got to tell you how they're going. It's a very, can be a very friendly place. My husband said, I live here.
The memories of those past and present who have been a part of the hospital remain fond and strong.
A lot of staff come and they stay, and that gives the place some soul.
There was a good feeling. People kind of wanted to work together, and it was a happy sort of environment.
It was a very close-knit hospital. All the staff got on well, nursing staff, medical staff, kitchen staff, everyone.
Oh, yes, it's home to me. It's home to me, yes.
I'm still proud to be a part of it.